Welcome to the Heroes of Healthcare podcast. I'm your host, Tim Fisher. Today, we're joined by Dawn Morton-Rias. Dawn is president and CEO of the National Commission on Certification of Physician Assistants. As many of our listeners know, PAs are a very important part of our healthcare system. I hope you enjoy my conversation with Dawn as she explains why she became a PA, what a physician assistant does, and why they are so critical to patient care. Dawn has an incredible story, and we are very thankful to have her on the show.
Good morning. Nice to see you.
Absolutely. We're thrilled to have you on Heroes of Healthcare. And I'm very interested and excited to share your story with all of our listeners. So let's just jump right in and start with, can you give a little bit of your background, where you were raised, where you were born?
Okay, great. Well, that's always exciting to talk about. So I'm born and raised in Queens, New York, New York City girl, product of New York City public schools, and went on to the State University of New York. There I was introduced to the PA profession by literally bumping into someone at the Health Science Center when I was a first year college student at Stony Brook University. Literally bumped into someone and asked them about their health professions, and that's how I learned about this profession that we're going to talk about this morning. But born and raised in New York City, Queens girl, as they say.
All right, so you went to Stony Brook, and that was quite a way to introduce yourself to someone and hear about what you're going to do in your future. So
Absolutely.
How did that conversation go? I'm just interested on how that conversation went.
Right. I was a 17-year-old student just looking around trying to figure out what kind of health science programs were being offered at the what was called the Health Science Center at the time. And so I was looking up at the signs and saw that they offered nursing and they offered physical therapy and occupational therapy. And so I wasn't watching where I was going. And I think that's been kind of symbolic of my career in that have found myself in wonderful opportunities kind of serendipitously. And so when I bumped into this older gentleman and he says, "Can I help you?" I said, "Well, I'm interested. I'm a brand new college student. I'm interested in the health profession, not quite sure what to choose. Nursing, medicine, physical therapy, respiratory therapy, whatever." And that's how he said, "Well, come with me and let me show you what we have, what we offer here." And being a little, being a New York City girl, I was like, "Okay, come with you, follow you. Where am I going?" But it was a good journey because he was able to introduce me to the career path of being a PA. The profession was still relatively new, not totally new, but still relatively new. And so he shared documents and materials regarding the PA profession, and that's how I became interested in choosing this profession. PAs are medical providers. We provide 70 to 80% of the services ordinarily provided by physicians. And we practice in collaboration with physicians and as members of the medical team. But we have a curriculum that is very similar to pre-med. And so you complete in your undergraduate curriculum, you complete your natural science courses, biology and chemistry and physics, etc. And then you go on to PA school, which is an intense abbreviated medical curriculum, if you will. It's about 27 months, 2.5 years of full-time postgraduate education, post-bachelor's education, and it's pretty intense. And so I finished at Stony Brook and then went on to Howard University to pursue my PA curriculum, and then came back to New York City and practiced in family medicine, addictive medicine, OBGYN, women's health, and also provided health care for the homeless. So I moved across a number of practice settings and disciplines throughout my career as a clinician.
You have, and then you got your doctorate of education at St. John's.
Right. Yes. So I was working in Brooklyn, New York at the time, and working at a community health center, and I became interested in teaching, was asked to provide a lecture, to precept students, and I was practicing at full time at the time. And so I became interested in teaching. And so I gradually moved into a teaching role where I became a faculty member and then a PA program director. And again, an older gentleman said to me, you're a young woman, you have a bright career ahead of you. If education and academe is something you're interested in, you're going to need a doctoral degree. And so while raising children, have three children, and while practicing and also teaching, I went back to school at night and pursued a doctoral degree in education. And I'm incredibly proud of that work because it was a juggling act. I often say that my children have sat in classes that I've taught and classes that I took because with three kids it was a lot of pick up and drop off and juggling around during those years, and so they were very close with me as I was pursuing this. So when I finally graduated, they were my biggest cheerleaders, making a lot of noise
I bet.
for their mom having reached this milestone.
I bet. I find it interesting as you're sharing your story, how the impact that a couple of conversations that happened by chance,
Yes.
really, and how they've had the impact on your life. And I share that because a lot of people are trying to find purpose in their life, and they're when you graduate high school and you're going to college, everybody wants to talk about what you're going to be your major. And when you graduate college, it's like, okay, what are you going to do? And there's so much stress and anxiety in the world over finding purpose and finding your why. But a
Yes.
lot of where you are today was shaped by a couple of conversations that you had with people that you really didn't know.
Absolutely. And so when I talk with young people and people who are finding themselves, and they'll ask me questions of, what was your journey and what was the path you took? I always share with them, keep your eyes open and your sights very broad, because, as long as you have a strong academic base, we can't underestimate the importance of a good academic curriculum and pre-college work and even liberal arts education in college and all of that, science curriculum and so forth. But to be so focused on one discipline or one profession very early in your career sometimes limits you from things that you might be passionate about if you even have the opportunity to be exposed. And so I often encourage those who seek out my advice to think broadly, know where your strengths are, know what you enjoy, because a career is something that you're going to spend your entire life pursuing, and you want to do something that you feel is meaningful, is valuable, that matches with your strengths, and so it doesn't feel like work every Sunday night. You're depressed, thinking, oh my goodness, I have to go to this job tomorrow that I don't want to do. You don't want to have that feeling. So to keep your sights broad, that served me very well, having a open mind and not knowing exactly what I wanted to do. I knew I wanted to be in healthcare, but exactly in what role, I didn't know, and I was open to the possibilities and the ideas that others could share with me, and took that information in.
Well, that's great advice, and I do feel like people always want to have all the answers, and a lot of life happens when we least expect it, and
Absolutely.
the impact that people will have on our lives, and that also speaks to us as we live our lives. Sometimes we say things to people and we don't think it's a big deal, but it actually changes their perspective as well. So,
Absolutely.
I mean, we're
Absolutely.
all in this together.
Yeah, no, I attribute many of my successes to the key people in my life who encouraged me, and gave me guidance and sometimes slapped my hands, to kind of redirect me and help me to focus and so forth. But yes, having people in your life that are willing to share their advice and their perspectives, and then having the patience to sit still and listen and take it in. I didn't follow every piece of advice that was given to me, certainly, but taking in a lot of information from others and learning from their experiences, I think, is helpful and valuable.
Absolutely, that's great advice. So let's go back. So you graduated from Stony Brook, then you went to Howard, got a PA certificate. So what happened? Like what did you do after that?
So I came back to New York City and was working at a community health center in Brooklyn, New York, where I took care of indigent population. And I've always been interested in caring for the medically underserved. We have in our healthcare system, we have a distribution problem. Yes, there are probably too few providers in certain areas, but where we're really struggling is providing health care for the underserved, people in impoverished communities, people who are uninsured or underinsured. And so I've always been very interested in that population and seeing how I could help fill that gap. So working in Brooklyn, New York gave me the opportunity to provide care for an indigent population. I went on to work in and coordinate a healthcare for the homeless project, where we set up mini clinics and soup kitchens and shelters and so forth. And we went around on a schedule to provide medical services where people were in need. It was a very non-traditional way to provide medical care, and my collaborating physician was at the home office, and so I would be in phone contact with her when necessary. But we took care of patients where they were, in drop-in centers and shelters and soup kitchens, providing medical services. And so that was my career, which I enjoyed immensely. Also, providing care for those who were addicted to substances, drug and alcohol, has also been a population that I've cared for. So I've always kind of had a soft spot for that population that struggles and that people look past. And at the same time, I started to give lectures and started to teach, and then gradually moved into a more academic role. And that's when I went back to school and started to pursue my doctorate and reduced my clinical practice to part time. Because it just became impossible to work full time clinically as well as doing the teaching and the academic administration while going back to school. So it required a little bit of juggling. And it was in my academic role that I was introduced to the role that I'm in now as president and CEO of the National Commission on Certification of PAs. So it's been a wonderful career. It continues to be a wonderful career in that it brings together my clinical work, my academic experience, my teaching and learning experience, the assessment concepts that I learned in my doctoral program, and now working in certification. It really just brings it all together very, very nicely.
Well, that's an incredible background, and I appreciate you sharing that with us. So, I mean, now you have a very big job. You're president and CEO of the National Commission on Certification of Physicians Assistants. Can you share a little bit about the mission of your organization? I know you've been in this role since 2014. Is that correct?
Yes, I just celebrated an anniversary. And
Congratulations.
yes, thank you. Thank you. So NCCPA is the only certifying body for the PA profession. Established in 1974, the NCCPA sets the standard for entry to the profession. And all states in the US have determined that NCCPA certification is required upon or for initial licensure. So we develop the certification examination. We are committed to ensuring that when the public and the employers and the payers and everyone in healthcare, when they see that PAC credential behind a PA's name, that credential represents attainment or demonstration of a knowledge base for entry to the profession. So everyone has cleared a bar, regardless of what school they went to, what state they're from. That certification indicates that they have, or documents that they have cleared a formal objective assessment. So we developed that entry level examination. So that's what we called initial certification. So NCCPA is very committed to ensuring that that standard is maintained and continually refreshed and updated as healthcare continues to evolve. So we go through a number of processes to ensure that the certification is reflective of what PAs are doing in practice, and as the healthcare industry continues to modernize and evolve with new technologies and new treatments and new diagnostic studies. In addition to that, NCCPA ensures that PAs maintain a standard through logging of continuing medical education and the administration of a recertification examination every 10 years. So it's not only initial certification, it's certification maintenance throughout the course of one's career.
How many physician assistants are there in the U.S., roughly?
So we at NCCPA have certified over 200,000 certified PAs, but right now with retirements and other things, there are about 179,000 board certified PAs in the U.S. and abroad because we have U.S. educated PAs that are working for the military and in other settings across the globe, and so our numbers are about 179,000.
Mm. Well, as you mentioned before, there's a evolving landscape in healthcare in general. Not enough physicians. Certainly, there's a lot of underserved populations and communities around our country, and that's putting more reliance on physician assistants, as you mentioned. So, I mean, can you talk a little bit about, for our listeners who may not be aware of that situation, why there's such a high demand for physician assistants right now?
Right. Well, that's a great question. Way back when I became a PA, my dad said to me, "Are you going to get a job with this?" Because the profession was still, relatively unknown and a few people knew about it. And so it's remarkable to see how the profession has grown and the space that PAs fill is very broad and it's very fluid. So of the 179,000 PAs, we're working in every discipline in every setting. So from cardiology to surgical subspecialties to family practice, dermatology, every clinical discipline PAs are working. 78% of PAs are either working in hospital settings or in office-based practices with hospital connections. And so they're connected to established, medical facilities. PAs are also working in rural clinics and in shelters and in universities and everywhere that healthcare is delivered, PAs are employed, and you'll find PAs working. Why this is such a demanding profession, or the demand is so high, is the distribution challenge, where there are pockets of the United States where there are very few physicians. There are rural communities or underserved communities, even what we call frontier communities within the United States, where you don't have providers. And so PAs, because of our education and our clinical training, are able to fill those gaps. So we're working everywhere. And so the question that people ask is, well, why would one want to become a PA? You have to have a passion for medicine. You have to have a passion for taking care of patients. Simply. You also have to have a good science background and all of that. But the profession provides so much flexibility in terms of your clinical discipline, your practice location, the ways in which you can work, because there's such a demand for providers throughout the country. So some PAs work full time, some PAs work two part-time jobs because they're splitting their time in a variety of settings. So there's no shortage of patients to be cared for. And when we look at the underserved communities, rural communities, even communities within inner cities, there are pockets where providers, especially in certain disciplines, are few and far between. One of the areas we see PAs becoming more involved in is certainly emergency medicine, psychiatry, mental health, behavioral health. So there's no shortage of need, and this profession enables you to fill those gaps very easily. And so there's a high demand for PAs. Very attractive profession in that regard.
Absolutely. A lot has changed since you became a PA, right?
Yes, absolutely, absolutely.
So if someone's in college and they're saying, "Hey, this physician assistant thing sounds like a great opportunity for me," can you walk us through what happens after you graduate from college and how do you become a physician assistant?
Okay. Well, one thing I want to share is that the title that we use the term title physician assistant and physician associate, because the profession has recently changed the name to be more reflective of the type of work that PAs are doing. And so each state has to go through a process to modernize those laws to reflect the change, the name change. But we still go by the term PA. So whether it's assistant or associate during this transition, That's the title that we go by. So there are over 308 PA schools, PA programs throughout the United States. Many liberal arts colleges and academic medical centers and other universities have PA programs. And so a student an undergraduate student would simply go to their career planning office or to their Office of Continuing Education, their graduate studies office to see what PA schools are in our community, what PA schools are close by. Most students in undergraduate who are interested in pursuing this profession complete a curriculum that looks very much like going to medical school. They will take biology and chemistry. They could have any major, but they would have to have certain science courses, for the life sciences in preparation for PA school. Most PA students going into PA school either major in one of the sciences or they can major in almost anything as long as they have the natural science prerequisites. And then they would enroll in a PA school. A PA program, like I said, is about 2.5 years, and they receive a master's degree upon graduation. And then they sit for this certifying examination, which enables them to become licensed to practice. The curriculum of PA school is pretty intense in that includes classroom work and laboratory work, and then a full year of supervised clinical practice or clinical training. So that's where students get the practical experience of examining patients and performing procedures and working in the hospital and learning how healthcare is actually delivered. So it's a combination of academic coursework as well as clinical training, clinical experience in that full-time 2.5 year curriculum. And so there are about 15,000 students that graduate each year from PA schools across the country. And as I mentioned, there are about 308 PA schools, PA programs, and most are affiliated with part of academic medical centers or universities.
The 15,000 that are coming into the workplace, is that keeping up with demand?
There is still demand. There is still demand. And so I like to tell young people there are no shortage of patients. Patients are still needing health care throughout this country. So there may not be as many jobs, excuse me, on Fifth Avenue in New York City or, in your most popular areas, but there are certainly communities within every state of the United States where there's need for healthcare, and PAs are filling those gaps all over the country. We work collaboratively with physicians, with nurses, with nurse practitioners, with other members of the healthcare team to ensure that patients have access to good care. And so, even with the 15,000, there's still unmet need.
Hmm.
One area that has grown tremendously where PAs are working is in telemedicine. And since the pandemic, there's been an increase in the number of PAs that are providing telemedical services to help bridge some of those gaps. But there's a tremendous need that still exists throughout our country.
Well, PAs are a critical part of the healthcare system for sure. And, one of the things that we talk about on this show a lot, and in my role at Jackson and Coker, is around the topic of physician well-being
Mhm.
and burnout. How do PAs, how are PAs well-being? Is that an issue for PAs as well?
Yes, absolutely. And the pandemic, I think, brought to the surface the need and the importance of wellness for healthcare providers across the board. And we are all kind of overachievers. When you think of who pursues this profession, most people who pursue medicine, whether as a physician or as a PA, are high achievers. And so we have a strong work ethic. And so we are at risk because we're in the caring professions. As I used to tell students, no patient comes to see you to check on you. They're coming to see you because they need you to take care of them. So if you're taking care of patients every single day, 10 hours a day, who is taking care of you? And you need to really be mindful of the importance of work life balance, of using your vacation time. Taking care of yourself is not being selfish. pulling away, taking time to have, enjoy other aspects of your life. Those are really important attributes for PAs as well as for physicians. And so burnout is real, and stress related reactions to this work is a risk factor, for caring for patients. And so I wouldn't say that we're doing a better job than other professions. We're recognizing that it's important. Wellness and self care is very important. And we have to encourage that, because it's not something that I think most of us think of initially. Maybe the younger generation of students and new graduates think they have a little better sense of work life balance than those of us who have been established for a while. So it's really a lesson that we could take from the younger generation on the importance of maintaining work life balance and self care.
Well, I know this is a general statement, but typically people who become PAs are about others first.
Yes.
They're focused on other people,
Yes.
and a lot of times, as you just mentioned, we have to care for the caregivers as
Yeah.
well. And I think sometimes we just show up. I'm guilty of this too. You show up at the appointment. A lot of times you see an NP, you see a PA, you see a physician, and you don't ask, "How are you doing?"
Nope. Not at all.
You're like, hey, you need to fix my problem.
Exactly.
But they're going through it just like we are, and at some point they're a patient as well.
Absolutely, absolutely. And so, in the educational process, and even in some of our continued education initiatives, we really want to encourage PAs to take care of themselves. And I think a lot of people choose this profession because it does offer a little more flexibility than becoming a physician, in that you're an employee for most cases, an employee in a healthcare system, as opposed to being a single sole proprietor. And so that gives you a little flexibility and a little more control in terms of building your work life balance. Many PAs at points in their lives will work part time as they're raising children, or they have other family responsibilities. And so there's a little greater flexibility in this role, than if you've chosen to become a physician. That intensity is a little bit different, I think, and that's one of the attractive features of this profession. And that's what we continue to hear that from new PAs entering the profession. I chose this profession because I want to, of course, take care of patients, but I also want to have a life and engage in my community service interests and engage in other aspects of my life that I'm very interested in and committed to.
Well, PAs are making a significant contribution to the overall healthcare of our country, and I know I speak for everybody. We're very appreciative to what you and all the PAs are doing. So, just a couple questions here as we wrap up. But in your role as president and CEO of NCCPA, you have a unique lens into our healthcare in our country. What are some things that you see, good, that could be good or bad, that we need to focus on?
Well, I think one of them we've spoken about, and that's provider wellness and providing time and attention to the importance of caring for the provider, and granting grace and permission for self-care. I think there's still this expectation of you take care of others, and so there, I think the need for work-life balance and self-care and care for the providers is an important concern. I think as we look at our healthcare system, it's a complex system, and patients are easily overwhelmed and exhausted by the complexity of the system. And to the extent that our system could provide greater support for patients as they navigate the system, as they navigate, well, who am I supposed to see? How do I get this bill paid? How do I get my prescriptions filled? How do I get aftercare? There are so many questions that the average patient is unable to answer. And in many cases, PAs and other medical providers are filling that gap. So I think the complexity of our healthcare system adds to the medical concerns that our patients experience. And to the extent that we as a society can support patients, because we're all going to be patients at some point in our lives. And so, to the extent that we could support patients as they navigate this complex system, I think is a need that continues to be unmet. But there are many, many challenges, and I think it takes all of us, physicians, nurses, PAs, nurse practitioners, therapists, and the list goes on, to take care of the range of patients that are in desperate need of care, and they're in need of compassionate care. They need providers to meet them where they are, to break down the medical terminology, to explain what's going on. It's what we do every day. So we speak the language, we understand. The average patient doesn't understand everything that's going on, and they're afraid. And so they need all of us as medical providers, I think, to refine our communication skills and to slow down and explain things that we take for granted, things that we know all off the top because we've been in this space for so long. The average patient doesn't know that, and so I think our communication skills are really, really important for patients and helping them to navigate the system that they're faced with.
Well, as you said, it is very complex, and it's not easy, even for those of us who live in this world.
Yeah,
And I think as you just said, that the whole caring part and taking time to build relationships, and make sure that it doesn't feel like a transaction.
exactly, exactly.
Because many times I know people feel like, well, I went and it felt like a transaction, and you're dealing
Absolutely.
with the insurance company and everything else. And at the end of the day, people want to get better, or they want to find out what's wrong with them, or and I think it's easy for it to turn into a business transaction versus what you just described.
Absolutely. And that's something that I think we can easily take for granted. As I used to tell my students, how many babies have I delivered? I don't even remember how many babies. And it's usually a very uncomplicated, routine process. But for every mother, and if you've asked any woman to describe their childbearing experience, it's a unique story. And you would think that it was the only baby that's ever been born, because that's how personal and unique it is for that individual. And I paint that picture for students and young people coming behind me, because that's how special healthcare is to that patient. To us, it's, how many times have you done the same thing? But the patient may not experience it that many times. And so we have to address their concerns like it's the only one that we've ever seen this way, that this is the unique feature of this particular patient, and help them to know that their concerns are special and important. And that requires that we go the extra mile, to explain things, to be compassionate, to get on eye level with patients. I mean, how many times have any of us been in a medical situation where the provider is standing over us, looking down, and you don't even can't even obtain eye contact because the body positioning is inappropriate. So just simple things to help the patient feel cared for and attended to would go a long way. And that's one of the hallmarks of this profession of being a PA, where we're taught early on to connect with people, even in the short time that we have with them, to help them feel and know that they're important at this time. We may only be with them for 10 minutes, but this 10 minutes is theirs, and that we are very interested in hearing what their concerns are and helping them to understand, what's happening to them.
Well, that's well said, and I think just by caring and the little things as you just mentioned, that would make a world of difference in our healthcare system as we try to figure everything else out as it's
That's
evolving.
right.
But it's interesting hearing your story from growing up, and then how that shaped you now, and the impact that you are making on the PA profession is huge. So just I'm very happy that the NCCPA has someone like you leading that organization. And I'm sure they're very thankful as well.
Well, I appreciate it. I think been a wonderful experience for me. It brought together everything that I've work towards as a clinician, as an educator, and also in the assessment space and the certification space. It's just been a great experience, and I feel it's important to bring the lens of the profession to certification. Certification is it's a heavy lift for PAs to sit for an examination and to maintain their knowledge base while they're raising children, while they're caring for patients. And so we've worked really hard over these years to ensure that our certification maintenance endeavors and our recertification examinations are reflective of what PAs are doing, and they're not overly burdensome, but they maintain a high standard. And so to strike that balance has been very rewarding for me and the staff that I work with to continually modernize the recertification process. And so that's been a real valuable experience for me in these most recent years.
Well, the reason we have this podcast is to shine a light on people who are true heroes and who are making a difference in our country. And we want to make sure that people are educated in a lot of different areas that impact healthcare. And, so I just want to say we're very thankful for everything that you're doing.
Thank you. Thank you. I appreciate
And
it.
you are a hero.
Oh,
Now,
thank you.
my final question is putting you on a spot a little bit. We always end the show with the question of who is your hero?
There are several people that have been heroes in my life, and I know most people say, some famous person or some celebrity or some political figure. I think my dad was a hero to me, and he instilled the importance of education. My husband's a surgical critical care PA, and I witnessed his frontline work during the pandemic when everybody was sent home to shelter in place. He continued to be a PA providing care on the front lines with all of the personal protective equipment and getting dressed in the garage to be sure not to bring home any pathogens from the hospital. So I have to say Derek Rias is a hero for me because I witnessed him, and he's just one example of 178,000, 179,000 PAs who were frontline workers, especially during the pandemic, who filled those gaps. When everybody else was running home afraid, those frontline workers were still taking care of patients, and they were still serving as the intermediary to patients who were hospitalized and who couldn't be visited by their family members, and who were afraid, and oftentimes who died alone during the height of the pandemic. And he and thousands of other PAs were filling that gap, and other health workers as well were filling that gap. And so I tip my hat to all of those frontline workers who were out there during the height of the pandemic, and especially in places like downtown Atlanta, New York City, San Francisco, other major cities where the pandemic hit very, very hard, and they needed people to take care of folks when there was still so many unknowns. And so that may be a little unconventional, but that's who I think of when I think of hero.
Well, I love that, and I think I think it's important to note we hear a lot of what's bad in the world and what's wrong with the world, but there's a lot of amazing people in this world, isn't there?
Yes, absolutely. Absolutely. They're unsung heroes out there making a difference every single day.
Yeah, they're running towards the chaos as opposed to
Absolutely.
running away from it, and
Absolutely.
that's what this show is all about is spotlighting those people. So thank you for sharing that, and we're very appreciative of your time, and thank you for being on the show.
My pleasure. My pleasure. It's been great meeting you and chatting with you. And thank you for doing this. This is a wonderful experience and wonderful opportunity for people to learn about heroes. So thank you.